nagbabalik mga kasambahay ang Doctors on TV. At dahil ang June ay National Kidney Month, ang topic natin this morning, chronic kidney disease. Panoorin muna natin ang video na ito.
Ang buwan ng Hunyo ay ang selebrasyon ng National Kidney Month ng Department of Health na naglalayong mas lalo pang mapalawak ang kaalaman ng publiko kaugnay ng kahalagahan ng pagkakaroon ng malusog na kidney o bato. Ayon kasi sa ulat ng Department of Health, ang end-stage kidney disease ay pang-7 sa leading cause of death sa bansa. Umaabot sa 23,000 Pilipino ang sumasailalim sa regular na dialysis dahil sa kidney failure at tinatayang tataas pa ng 15% bawat taon. Sa talaan ng National Kidney and Transplant Institute o NKTI, isang Pilipino ang nagde-develop ng chronic renal failure bawat oras o 120 sa bawat 1,000,000 tao sa bawat taon. Tinatayang 1.1 milyong tao sa buong mundo ang sumasailalim sa renal replacement therapy bawat taon. Ayon sa mga eksperto, ang ilan sa mga nangungunang dahilan ng pagkasira ng bato ay ang sedentary lifestyle, wrong food choices, at kakulangan ng tamang tulog. Kaya naman pag-usapan natin ngayong umaga, paano nga ba makaiiwas sa pagkakaroon ng chronic kidney disease sa tulong ng mga expert. Doctors on TV.
At yan po mga kasambahay, ang topic natin for this morning, chronic kidney disease. And to help us understand our topic better, we've invited 2 nephrologists from the National Kidney and Transplant Institute. The first one, an adult nephrologist specialist, Dr. Maaliddin Biruar, or as we fondly call him, Doc Ding Dong. Good morning, Doc.
Morning, JM.
Good morning,
Thank you for
Doc.
joining
Good
us.
morning.
Ang residente ko dati si Dr. Ding Dong.
Oh, really?
Ang clerk ako sa East Avenue Medical Center. Senior resident na si Doc Ding
9
Dong.
years ba yun?
Back in 2001. Tagal na, no?
Speaking. Okay. Now we also have a very special guest this morning. She is a pediatric nephrologist, Dr. Lorna Simangan. Good morning,
Okay.
Dr.
Good morning, Dr. Thank you for joining us this morning. Aga natin gumising para sa program natin. Thank you for joining us. Doc, ang topic natin, chronic kidney disease. Ano bang usually ang ginagawa ng kidney at anong nakakasira sa kanya, Doc?
Well, some of the functions of the kidney, very important is of course, trying to control excretion of water in the body and the amount of water we have. And then it also metabolizes most of the food that we eat. And then we're also involved in control of electrolytes like calcium, phosphorus, potassium, and sodium. And then we also the kidneys pala, are also in charge of releasing a hormone which is called erythropoietin, which is important in producing red blood cells. So, have I forgotten anything?
Also, the vitamin D.
Yes.
Yes,
Okay.
it's part of activating the pathway para better ang absorption. For
kidneys
the calcium metabolism.
Get rid of excess water,
Yes.
pati ibang toxins na
Pati
sa
ibang toxins.
katawan natin.
And also blood pressure. It releases renin, which is responsible for controlling the blood pressure in the
Okay.
body.
So, hindi lang excretion ng mga toxins and excess fluid, pero marami siyang trabaho sa red blood cell production, so vitamin D, so calcium po, no?
Calcium,
And then also for blood pressure control.
Yes.
Yes, napaka-important ng ating kidneys.
Oo.
Kaya, naku, marami tayong pag-uusapan ngayong umaga. But, para po sa mga nanonood sa atin, no, narinig kasi na ano ang acute, ano ang chronic? Pwede niyo ma-distinguish?
Well, when you say a kidney disease is acute, it means it has only existed for, say, a few weeks.
Okay.
But if you say chronic, it's at least 6 months. No? So, matagal na siyang may problema sa bato. And usually, at that period, the kidney already has some degree of scarring. So, meron na siyang, parang may lamat na talaga yung kidney mo.
Okay.
And then by prognosis, yung acute kidney injury, we're given at least 2 to 3 months to tide over na sana ma-reverse. Pero beyond that, it will also end up as chronic kidney disease.
So, acute pwede pang i-reverse.
Yes,
So, pwede maging normal ulit.
Yes.
Pero pag chronic, usually tuloy-tuloy na, no?
Nagpa-progress
Kasi
na
hindi
siya.
nag-regenerate ang kidney tissue.
Yes, that's right. That's correct.
Ano ba yung usual causes ng kidney diseases?
Well,
sa adults muna
sa
tayo, no?
adults, no? The number one cause of the chronic kidney disease actually is diabetic nephropathy. I think it was also mentioned by one of the guests earlier.
Okay.
Around 45 to 50% of those who undergo dialysis in the Philippines and actually worldwide, no, suffer from diabetic nephropathy. Actually, para rin sa kaalaman ng mga audience natin, medyo problema talaga yung diabetic nephropathy kasi mga 12,000 to 14,000 patients every year start on dialysis kasi sirang-sira na yung bato nila. And then the next would be hypertensive nephrosclerosis and then glomerulonephritis and other causes. So, most important yung diabetic sa adults.
Kaya naman tinatawag na silent killers ang diabetes tsaka hypertension.
Yes.
Kasi sa umpisa, wala naman naramdaman ng pasyente kaya hindi sila natatakot, hindi sila umiinom ng gamot, pero unti-unting sinisira ng diabetes at ng high blood ang bato natin.
Correct.
Tama. No? Sa mga bata naman, Dr.
Sa mga bata naman, kasi ang chronic kidney parang endpoint na siya. No? Summary na siya ng any summary of insults na nangyayari sa kidney. So as early as prenatal period, may mga napipick up ng risk. Like kunyari, magana pala yung kidney, may prenatal hydronephrosis na to begin with. Ito minomonitor kasi eventually ang baka manifestations niya in the line ng urinary tract infection.
Okay.
And recurrent infections can cause scarring and later pwede mag-damage.
So, pabalik-balik na urinary tract infection.
Oo. Internationally, ang reported na high risk for CKD and warranting transplant later are urologic problems related sa recurrences ng urinary tract kasi inborn na yung birth defect.
Okay.
But locally, what we have as a high rate is inflammation of the kidney, no, generally termed as glomerulonephritis.
Glomerulonephritis.
Di ba?
Okay.
Pwedeng infectious siya, pwede siyang immunologic. And then yung mga systemic, medyo may tie-up na kami ng konti. Yung mga hypertensive early on at saka yung mga diabetes na adolescent age.
And even bata pa lang, meron na nagkakaroon ng
nagkakaroon na.
diabetes tsaka hypertension. No?
Yung mga bata rin actually nagda-dialysis.
Meron na rin.
Nagda-dialysis na rin. Oh. Actually, everywhere we go, ang dami natin nakikita mga dialysis centers na
Ang
coming up, no?
working statistics, mga 10% kami ng ongoing rate ng adults sa
Okay.
line-up ng mga nag-end up ng CKD.
Sa pediatric
Chronic kidney
nephrology.
disease sa pediatric nephrology.
Bakit kaya dumadami yung mga kaso talaga ng mga nagkaka-kidney failures?
Well, siguro kasi kung makikita natin yung incidence ng diabetes, tumataas din. So I think it's closely related to that. So because there are more diabetic patients now, then there are more patients on dialysis also.
Okay.
Tapos yung public health impact natin, no? I-combination na tayo . We haven't truly solved the infectious nature ng mga illnesses natin related sa kidney. Tapos pumapasok na itong mga hypertension, diabetes, na parang nagiging double burden ang disease natin ngayon in line with the kidney. No, hindi natin natatay over pa yung infectious part, pero eto pumapasok na itong mga morbidities na to in relation sa adult.
It's really important to control your diabetes and your hypertension. No?
Yes, Jay, important.
Kasi mas linya ako talaga.
Ay, oo.
Mas linya ko talaga. So, before pa makarating sa inyo, dadaan mo na sa endocrinologist din. And it's our job to prevent patients going to you. Tama ba?
Exactly. Para hindi na umabot sa ganoon. So, bigyan lang natin sila information, no? Okay, how high, pag-usapan ng blood sugar, and for how long? Huwag nilang patagalin bago sila masira yung kidney.
Well, actually, once you are a diabetic kasi, you have a high risk of developing other complications. And now, as I've said, mga 50% of the just to educate everyone, no? Sa lahat ng may diabetes, mga kalahati doon magde-develop ng kidney problem. At yung sa kalahati na may kidney problem, magde-dialysis. So, they will develop renal failure. So, like if you have diabetes, meron ka ng 25% chance na mag-dialysis. So regarding the blood sugar, I think we try to maintain a blood sugar of 7 or lower, right?
Yes.
With medications
HbA1c.
na HbA1c. So pag hindi na control ng maganda yung blood sugar mo, pero hindi lang yun, nabanggit din ni doktora, blood pressure, repeated insults on the kidney yun. So mababawasan yung function ng kidney cells mo, bababa yung kidney function, tataas yung creatinine.
So, yun yung dapat nilang bantayan.